Welcome everyone, I'm Dr. Mo and I'm a general dentist. Today I will be critiquing Dr. John Yu, a pediatric dentist in the United States, oral care routine.
This is a tongue scraper. So this step, most people don't do it. You should do it. Yeah, you should do it. It is really important that you stick it as.
So I agree with that you should clean your tongue. However, they're saying using tongue scraper is fine. Also, I had seen that, for example, using a toothbrush, if you don't own a tongue scraper, can help with cleaning the tongue.
As far back as you can into your throat without gagging. And oftentimes I will gag because.
Okay, so funnily enough, regardless of their intentions, but some people have something called the gag reflex, and they actually struggle a bit both on the dental chair, dentist chair and the visit, and also at home doing their oral healthcare routine because of something called as a gag reflex. Now, the problem with the gag reflex, normally it's not, it is involuntary. Meaning it happened like without you being too much conscious of it happening. So that's why sometimes even extremely difficult for the dentist to, can be challenging for the dentist to work in patients with gag reflex.
That oral hygiene sexy, guys. Let's guess today. So all the way from California to be.
So Jack Han looks like his friend, a dental student, is joined with Dr. John Yu, which I mentioned is a pediatric dentist. Pediatric dentist is a dentist who predominantly deals with younger age patients, and also, to my knowledge, I don't know, it depends on your jurisdiction and the country, etc. Normally, the pediatric dentist is also experienced in treating handicapped patients and so forth.
Sitting here. Just kidding. He's here for his Colombian externship, but in the process, drop by to talk.
An externship is where like a dental student would go to a different university, either to do some courses there or to practice or train dentistry in some patients there.
About a very hot topic. What are we talking about today, Jack? We're going to talk about
what is there with their hot topic and sexy routine?
Perfect oral hygiene routine.
Okay, so let's see the perfect oral hygiene routine.
You think the routine's perfect? You know, I don't think anything is.
I love how even in a sarcastic manner, he criticizes the word perfect. Again, there's like saying the more you know that the more you get concerned. Because I don't know about the word perfect. It's too strong, but let's see the perfect oral care.
Perfect in this world. You are, feel like a lot of us haven't got perfect in this world. You are, I feel like a lot of us haven't got taught properly how exactly a oral hygiene routine should work from.
So I agree with this, and that's why I created my channel, is to provide education and awareness in relation to oral health care and taking care of your teeth and gums.
Each step that we will go over, from flossing to brushing to mouthwash to tongue scraping to whitening to everything else in between. Okay, so we're going to organize this into the step-by-step routine, what products you should avoid. Yeah. Surprisingly, there are things on the shelf that I don't think should ever belong there. But
so I agree that there are certain products that the consumer should avoid, and also some of these products are marketed very aggressively to you, and sometimes with not so accurate claims. So please be extremely cautious whenever you're buying or looking at these products, or you see an advertisement of these products.
I don't know how they're up there. Yeah, marketing, profit margins.
Yeah, as I said, aggressive marketing, unfortunately, of these products. Some of these products actually could be really expensive.
It makes me sad that some of these really popular items are still up there. Okay, so number one, flossing. Personally, I floss before the brushing. I do as well, yeah, before. The idea is that you're debriding or removing the bacterial colonies between your teeth, and then you're brushing it away with a toothbrush. Exactly.
So I agree with flossing prior to brushing your teeth. I think it's fine. The primary purpose is because you're trying to clean areas that are called the interdental areas. An interdental area is these area that are between your teeth, and they're cleaned predominantly by using either a string floss, which is what you saw, and also there's something called as a water flosser, and there is something called as an interdental brush, and some people use a toothpick, a wooden toothpick as well. So I don't advocate the use of a wooden toothpick. The reason being is that the tip of the wooden toothpick is extremely fragile and it can break easily. If it breaks and gets stuck into your gum, then you may get a foreign body reaction and that gum may swell. So normally I'm against a wooden toothpick.
So it's called biofilm. Bacteria colonies kind of stick and make a layer onto your teeth that more.
So this is typical of a dental student. They will try to use too many scientific terms like biofilm, and it's correct what they're saying. So biofilm consists of these aggregate bacteria and debris and byproducts of these bacteria. Let's have a look of this image that's shown here. So we have a bunch of inflamed gums, and these the gums located between your teeth, as we said, right? The term's interdental, right? So this is called the interdental, and because it's shaped like this, they're called the interdental papilla. And looks like also this patient has a receding gums in some region. And also, you can see the redness, exaggerated redness in certain regions, indicating also inflamed gums. We can see the remnant of this debris that's called plaque, and also there is this yellowish grayish stuff that's stuck on the tooth and looks a bit more hard, and that's called calculus. Calculus, not the math, but dental calculus.
Bacteria can just accumulate, and then plaque turns into calculus. Your teeth, that more bacteria can just accumulate.
So I love this illustration, and what we can see the normal tooth. You have the healthy gums, you have the enamel. Enamel is the most external layer of your tooth, at least at the visible part. Well, you may say, what that's for the crown. What about the root? The root has its external layer. It's called cementum. Okay. And so then you have the bone. What type of a bone is this? It's too technical, but it's called alveolar bone. Alveolar bone is part of your jawbone that is supporting your tooth. And once you lose your tooth, a big portion of that alveolar bone gets resorbed, right? And hence, like that appearance of a shaven off, like lowering that level of the bone after you lose the tooth. Well, now you know why, because the alveolar bone exists predominantly to support your teeth. Once the alveolar bone is weakened and it gets further away from the tooth and at a lower level, your tooth may become more mobile and less supported. We can see here something called as deepening pocket. We call this a periodontal pocket. And the plaque and calculus that we talked about, and the redness and the signs of inflammation in relation to the gums that we also discussed. If you can see, I don't know if it's too clear for you, you can see like there's the healthy bone level and there is the bone loss that happen. When bone loss is happening, we're getting into something called as periodontitis. Generally speaking, if that inflammation is a bit more restricted to the gums, then that's called gingivitis.
Accumulate, and then plaque turns into calculus. Calculus turns into inflammation. And then inflammation ultimately turns into bone loss, and bone loss into missing teeth.
Yeah, so it goes down this whole cascade of events.
Just as he mentioned, it's a cascade of events, meaning something follow the other and the other, and then you get the final product of loose teeth and diminished amount of gum and bone.
Just to keep things simple, you know what I say to my patients about flossing? I work with kids. So flossing is the last thing that they ever want to do before they go to bed.
I would say definitely pediatric patients, kids. They are somewhat some of the most difficult patients to deal with. However, it's also a rewarding experience when you get the kid to become cooperative and you teach them things and good habits from a young age in relation to oral healthcare. And then also some of these kids, if you're at the same practice as the dentist, you see them grow up and carry those good values in relation to oral healthcare and when they grow up.
So I'll tell them, hey, little Jack, what's your best friend's name? Jake? Let's say that you and Jake went to play football in the mud. It was raining outside. And you come back in and your mom tells you,
That was definitely not football.
Jake, you boys have to go shower. And Jake says to you, hey, Jack, can I tell you a secret? Can I tell you a secret? Yeah. When I go in the shower, I never...
So you can see how long of story he has to make just to tell the kid the plus, because the kid is not like sitting and listening to your instructions directly. The kid that's sitting doesn't even care about anything. He just like doesn't even want to be there. So you need to sort of have that framing, right, for the kid before you talk.
Never wash my legs. I just hate washing my legs. And usually the response, it's, ew, gross. Yeah, it would be. So then I tell them, hey, you're doing the same thing when you're not flossing. You're missing up to 40%. I don't say 40% to a kid because they don't know what it means. I just say you're missing a large part of your tooth.
So why is that? Because there's a like a significant surface area of your tooth that is interproximally, i.e. between the teeth that you're cleaning when you are using a floss.
So when you put it that way, it's a tremendous amount of surface area. Cool. We established the importance of flossing. What do you do after that?
After I loosened up all the debris, go to my toothbrush.
What kind of toothbrush do you use?
I believe that it's better.
So there's a huge discussion about this electric toothbrush, manual toothbrush, soft toothbrush, medium or hard toothbrush. So what do I follow personally? So I follow the ADA guidelines. ADA is the American Dental Association, and what I had seen, there's a sort of a recommendation on a soft toothbrush, I think, to brush 2 minutes twice a day for I think 2 minutes each. If I'm not mistaken, it's on the official ADA website using a soft toothbrush. Now, when I say soft toothbrush, I get to 200 people in the comment section getting angry and saying, my granny, Susan used a extremely hard toothbrush and she survived until age 270. Listen, I don't have any issue with your granny Susan. I'm just saying about the current ADA recommendation and what we're following, and a soft toothbrush will do the job. I think what the issue is that the people use toothbrush for extremely long periods of time, because remember, you need to replace that toothbrush. How often? We're saying roughly maybe every about 3 months, somewhere around that range. Also, you have a recommendation in relation to this on the ADA website, the American Dental Association website. I think it's mentioned I need to check it again, but it's maybe every roughly 3 months or so. Or until the toothbrush gets, like they say, frayed, or like it gets, I don't know, too weak, or it's not functioning efficiently. So why would you use the same toothbrush? So better to change it.
Better to use a electric toothbrush because it just has that extra element of either vibration or oscillation that helps you remove all the gunk.
Exactly. There have been a lot of research recently about the efficacy of electric toothbrushes. It can be more effective at reducing plaque in the right hands. The single biggest takeaway.
So as I mentioned, I just double checked the ADA recommendation, and on their website, replace toothbrushes every 3 to 4 months or more often if the bristles are visibly matted or frayed, right? As I mentioned, so every 3 to 4 months, or otherwise, as they mentioned, there is a problem with the bristles. Why? Because you want a toothbrush that cleans your teeth effectively. Otherwise, what's the point of you using a poor or a really bad toothbrush?
Direct the brush towards your gum line. It should be called.
So he also mentioned claims in relation to electric toothbrushes being better in comparison with manual toothbrushes. And I have done my research prior to the episode about this. I have found systematic reviews, meta-analysis, and some studies in relation to this. It's actually true what's mentioned on these studies. That being said, also a manual toothbrush will do the job. I will comment about electric toothbrushes for patients with a poor manual dexterity, meaning patients that are a bit handicapped, or perhaps elderly patients, or patients who would not otherwise hold or use the toothbrush properly and with adequate not pressure, but adequate pressure and proper use of the toothbrush. They would be advised generally to use an electric toothbrush. Manual toothbrush also will do the job.
Oh, tooth gum brushing. I'm gonna read that. Okay, can I give one?
So I think he said to angle the bristles or the toothbrush at the gum line. The technical reason is because roughly we want to be at 45 degree angle. Again, nobody is drinking, I don't know what you call it in engineering and measuring the actual angle, etc. But the rationale is, if you look at these pictures of the gum inflammation that we saw a bit ago, these photos, and if you can see, normally the fat and plaque are accumulating roughly around the gum line. So why wouldn't you be intentionally trying to clean or focusing on these areas when you're brushing, and of course cleaning the rest of the surface of your tooth.
Untip though, yes sir. In terms of actually the brushing part, how to properly brush those really hard to reach areas like the back of your teeth is, let's say I'm brushing my left side, I move my jaw to the left side.
Yeah.
That opens up space up here for me to get over there with the tooth.
So look at the 45 degree angle that I just discussed a bit ago. Again, I said that term is too technical, or you could say it to the patients. Fair enough. It's understandable because this is a 90 degree, 45 degree is roughly like this. And you do the same for the upper, and then you do that 45 degree toward the gum line. For the lower, it's easily understandable what he said about moving your jaw to the same side to open up a space. I agree with this in relation to the structures of your jaw and the temporomandibular joint and the structures of your jaw. When you move this way, it does open up space. It is actually true, and the reason this is important for us as dentists, like a dental consideration, is that when we are removing a wisdom tooth on this side, we would want you to open your mouth this way, or at least I speak of myself. This was a tip given to me from an oral and maxillofacial surgeon, and it saved me a lot of time, gave me easy accessibility and vision to the wisdom tooth in that area. I don't know why I'm moving the cursor there and they're moving his wisdom tooth, the guest, but you get the idea.
You brush inside your mouth. Yeah, the posterior part. You look great. You can angulate. Is this what you wanted from me? I didn't say anything. It's because you saw me yesterday. No, this is your favorite step. Oh, stop it. You're going to talk about where I'm scraping? I didn't say anything. It's because you saw me.
So they will discuss tongue scraping. And there are actually, you'll be surprised by how many patients who give nearly zero consideration to clean their tongue. I'm not talking about like my patients or something. I'm saying to the population in general. I think this deserves a lot more exposure and education, because many people think about their gums, teeth, and for some reason they disregard the tongue. Your tongue should be cleaned as well. They discuss tongue scraper. A tongue scraper is a particular oral healthcare instrument that you could use to help in the scraping or cleaning your tongue. And as I said also, that some use a toothbrush to help with this. The rationale is you should clean your tongue.
Yesterday, this step, most people don't do it. but it's always a good idea to do it.
You should do it.
Yeah, you should do it. And the biggest reason why is because, you don't want girls to run away from you.
So he's saying you don't want girls to run away from you. He's referring to a poor mouth odor and a bad mouth breath and smell. It's actually true. If you're just cleaning your teeth and gums and you're completely disregarding your tongue. Actually, if you want to, I'm not advocating anyone to experiment with this, but maybe you saw it on some of the days where you consume a lot of coffee. And trust me, I drink a lot of coffee. I don't advocate people to do this, but you see then after a while during the day when you look at your tongue, and it's like has that a brownish stain and discoloration. Well, because your tongue also needs to be cleaned. And even if I would scrape it or brush it, then I would see my tongue go back to the normal color and texture.
When you're speaking to them, right? Or guys.
I would run away from you if you didn't use that.
Yeah.
What is it called, Jack?
Okay, so this is a tongue scrape.
So it's actually true. A lot of people think about this in a dating or in like a relationships context, but even if we're friends, like if I had a friend who, and the problem is extremely embarrassing or so, like you can't even point out or say without being rude. So it's best just to have the best oral healthcare practices and subscribe and turn on notification bell so you could have.
It's a very simple tool. You can have these plastic ones, you can have metal ones, stainless steel ones, but they all serve the same purpose, which is to remove bacteria from your tongue.
Look at how much of that dirty stuff was removed. Of course, big part of it was saliva as well, but his tongue after scraping.
Most of the bacteria is going to reside on the way back of the tongue. So it's important that you sit
so that they keep laughing because they're referring to the gag reflex.
It is really important that you stick it as far back as you can into your throat without gagging, pretty much. And
so Dr. John Hughes is genuinely confused as to where is this actually go.
I will gag because it means that I'm doing a really good job. You don't have to, you don't have to, but
I don't know why Jack is promoting the gag reflex. Is it a gag reflex?
So the gag reflex that we discussed at the beginning of this video, of course, they're trying to talk about it in a bit of a humorous way.
They can be very uncomfortable, to be quite frank.
Yeah, of course. You can do.
Get as far back there as you can,
Yes.
without being uncomfortable. Jack,
Personally, is being uncomfortable. I like pushing myself to be, do uncomfortable things.
I don't know why it turned into a motivation video.
Then take risks. You land, you're rising, and you grow more. You want to be miserable with the uncomfortable, and that's how you can achieve more, guys. Right?
Okay, all jokes aside, and it's quite satisfying to see all the gunk come off. Every single time I brush, I use a tongue scraper. It can help freshen your breath, profit margins. Not us. Because don't.
Yeah. Okay, so remember we talked about summer using the toothbrush to clean the tongue. Now they have a question to address. Can I use the toothbrush to tongue scrape? Right? Let's see.
Now, what do you think about people who use a toothbrush though?
Also effective.
Not us.
Okay, so we didn't say it's more effective than a tongue scraper. However, it's a viable option. It's a viable way to clean your tongue, better than having a dirty tongue.
Because, again, I applaud the effort.
Yeah.
But the soft bristles will actually move around some of the gunk.
Okay.
And you might get some of it off. But the hard surface of this will actually remove more.
I did not know that. But, you are the board certified PD certified freak 7 minutes a week.
So actually, Dr. John Yu, we joke and I'm reacting to this video, but I have a ton of respect to him. He's very highly qualified, and that's why I picked this video to react to.
Trust me, you will not regret it. And once it's part of your routine, you're going to be like, wow, I wish I had done that before.
Yeah.
When did you start using a tongue scraper?
Recently.
So at least he's being honest, and it's completely fine. Perhaps he used a toothbrush beforehand.
A few months ago. To be honest.
I would run away from you if you didn't do that.
Yeah.
I love the honesty.
Because most people, we don't grow. Most people don't. No,
I didn't even know it.
Not only about the tongue scraper, even normal things such as dental floss. I mean, if there was a poll and everyone would answer truthfully, I'm not sure how many people consistently on a routine basis every single day are actually using a dental floss, and most probably they should.
It existed. I think more people are aware of it now because all these routine trends, like you see YouTube videos on the nighttime oral hygiene, which we should make a video on. One of these days, you can do a sleepover with me.
Yeah. And then we can see how far we can. They assert, friends, it would actually be worse than not using a mouth.
Oh, you've raised a lot. The first time I heard about this in dental school, about the pH of some of these popular mouth rinses on the market.
So why is pH important with regard to oral healthcare? Because your teeth external layer, the enamel, typically has something called as a critical pH, and if you drink a lot of acidic drinks, or you eat a lot of acidic foods, or you consume a lot of acidic products throughout the day for a prolonged period of time, you may be keeping your teeth near or below that critical pH. Again, you may be thinking, what is the value of that critical pH that are references? That is 5.5. From what I understood is that it's not extremely fixed at that number. Again, there's a bit of conflicting opinions. I heard in relation to this, but what we need to know that pH is important in relation to oral health care.
So it's like, holy crap, you have to look at the pH of your mouth rinse, because if it's under a pH of 5.5.
So that's what I said. There's that critical pH level. The Canadian Dental Association has it on their website, 5.5. I'm just saying a comment where I read on certain articles that it may be, in university they taught it as 5.5. They're just questioning that fixed number. Is it the same across everyone? Is it roughly around that number? Is it different if you're taking better care of your teeth and your enamel and so forth?
Then you're subjecting your teeth to demineralization.
So demineralization is a state where the enamel of your tooth is being more softened and vulnerable to decay and dental caries. You do not want your teeth to be in a demineralization state. In fact, if anything, you want your teeth to be in a remineralization state, okay, where they're fixing the stuff and hardening that softening.
Thankfully, there are products out there that have a pH higher than 5.5. And I will add one thing is definitely try and find mouthwashes that are alcohol-free.
So there's a whole note about the alcohol-free. I don't want to make this video too long, but I think I either uploaded or will upload as soon. I recorded a video in relation to oral mouthwashes, alcohol-free, therapeutic, cosmetic mouthwashes, and so forth. There's also on the ADA website recommendations and classifications of oral mouthwashes.
As alcohol tends to dry out the mouth, and if your mouth is dry, then it is more prone to getting caries.
Right.
So why is that? Because your saliva contains calcium, which helps in remineralization. It contains fluoride, and for the anti-fluoride people, probably may get angry to hear this. I'm just kidding. And also contains other important components that helps in the process of remineralization. Not only this, but I have read across some studies that it mechanically help pushing some of the food away, and of course in the chewing and so forth.
That's a good point. More and more products out there now are alcohol-free because more consumers are aware of it also. Yeah. The last thing we want to mention is a topic that we hear about every single day. I think we should actually make a separate video about whitening.
Yeah, absolutely.
Because this is such a huge topic.
So I will make a separate video about teeth whitening also.